Hello everyone, welcome to Gnana Deeksha concept-based digital learning. This is Dr. D. Vasavi from TSWRDC Mahabubnagar. Observe the pictures shown here. What does it indicate? Yes, it is a rash. Do you know why does this happen? Okay. Does it occur to everyone? No. Only few people show this type of reaction. This is called as allergy or hypersensitivity. It was von Terquet who had used the term hypersensitivity to describe an altered reaction he had observed in his patients. In today's class, we will learn what is hypersensitivity, types of hypersensitivity, mechanisms underlying different types of hypersensitivity, various examples of hypersensitivity, diagnosis, prevention and treatment of hypersensitivity. Hypersensitivity. Hyper means exaggerated and sensitivity is response. It is an undesirable reaction or allergic reaction seen only in 10% of individuals because of overreaction of a person's immune system. The substances responsible for such reactions are called allergens. Allergens may be food, chemicals, clothing, drugs, plant parts like pollen or leaves, animal dander, fungal spores, etc. Common food allergies include eggs, milk, peanuts, tree nuts, fish, shellfish, wheat and soy. Drugs like penicillin cause allergy in some individuals. Baby wipes also contain chemicals which may cause allergy in some infants or young children. Certain soaps and perfumes can also cause allergic reactions in some individuals. Now, let us see the types of hypersensitivity. In 1963, British immunologists Coombs and Gell have classified hypersensitivity into 4 types. Type 1 is immediate type of hypersensitivity called as anaphylaxis. Type 2 is cytotoxic or antibody-dependent hypersensitivity. Type 3 is immune complex mediated hypersensitivity and type 4 is delayed type or cell mediated hypersensitivity. Type 1 hypersensitivity, that is anaphylaxis. Ana means without and phylaxis is protection. Anaphylaxis is without protection. Generally, we know that antibodies are protective in nature, but in anaphylaxis they are not. Anaphylaxis is an immediate type of hypersensitivity, means it occurs within minutes or hours after second exposure to the antigen. It is mediated by IgE antibody which is involved in allergic reactions. Examples of anaphylaxis, they are atopy. Atopy means out of place or strange. The term was given by Koka and Cook in 1923. It refers to the genetic tendency to develop allergic diseases such as allergic rhinitis, asthma, and atopic dermatitis caused by the allergen. Allergic rhinitis. Rhino refers to nose and itis means inflammation. This is also known as hay fever. It is a type of inflammation in the nose which occurs when the immune system overreacts to allergens in the air. The signs and symptoms include a runny or stuffy nose, sneezing, red, itchy and watery eyes and swelling around the eyes. The fluid from the nose is usually clear. Asthma. Asthma is a condition in which airways of the person narrow and swell and may produce extra mucus. This can make breathing difficult and trigger cough. A whistling sound called as wheezing is also produced while breathing and causes shortness of breath. For some people, asthma is a minor nuisance. The symptoms are cough and wheeze. Atopic dermatitis or contact dermatitis is another one. Derma refers to skin and itis means inflammation. It is a red, itchy rash caused by direct contact with a substance or an allergic reaction to it. Now let us see the mechanism of anaphylaxis. The allergen enters into the body through different routes like skin, by injection or inhalation or ingestion. During the first exposure, the allergen stimulates the production of IgE antibodies, which go and bind to the mast cells and basophils. This is called as sensitization stage. Again, when the same allergen enters the body for the second time, it directly goes and cross-links with the IgE antibodies which are already formed in the first stage. This cross-linking causes degranulation of mast cells and basophils. Degranulation is release of granules. The mast cells and basophils are highly granulated cells. The degranulation of mast cells and basophils releases two kinds of inflammatory mediators. These are the primary mediators and the secondary mediators of inflammation. The primary mediators of inflammation include histamines, eosinophil chemotactic factor of anaphylaxis, platelet activating factor, prostaglandins, and basophil kallikrein. And the secondary mediators are serotonin, bradykinins, heparin, leukotrienes, prostacyclins, thromboxanes, and slow reactive substance of anaphylaxis. In general, all these mediators, they cause reactions like vasodilation, that is dilation of blood vessels, increased mucus secretion, increased blood flow, smooth muscle contraction, platelet aggregation, bronchoconstriction, that means constriction of bronchioles, or bronchodilation, dilation of bronchioles, nerve stimulation, stimulation of pain receptors by kinins, anticoagulant activity by heparin, etc. The clinical manifestations of this anaphylaxis are two types, systemic and localized. A systemic anaphylaxis is shock-like and often fatal state. It is initiated by entry of allergen directly into the bloodstream or absorbed from the gut or skin. The symptoms are labored breathing, means difficulty in breathing, drop in blood pressure, smooth muscle contraction, constriction of bronchioles and suffocation. Localized anaphylaxis affects a particular tissue or organ like nose or skin, often involving epithelial surfaces at the entry of the allergen. The symptoms differ in different parts of the body depending on the route of the entry of the pathogen. Coming to the next one, the type 2 hypersensitivity, which is cytotoxic or antibody mediated hypersensitivity. Here, the antibodies involved are IgG and IgM. In addition to these antibodies, the target cell is also killed by natural killer cells or the complement. The complement is a group of blood proteins. It kills the target cells by the formation of membrane attack complex. It causes release of the contents of the cells by formation of pores. Erythroblastosis fetalis, thrombocytopenia and myasthenia gravis. Hemolytic anemia. Hemo refers to blood. Lysis is breakdown of blood cells. This is the reduction in the number of red blood cells by lysis. It may occur in the presence of a drug and becomes normal after the removal of the drug. The drug binds to the red blood cells and antibodies are formed against the drug, which activates the complement and causes the lysis of the red blood cells. In case of erythroblastosis fetalis, which is the type of hypersensitivity where complications are seen in a child born to a mother with Rh negative blood group and an Rh positive father. As Rh positive is a dominant character, the children also inherit Rh positive blood group. During the delivery of the first child, the fetal and maternal blood gets mixed up and the mother develops antibodies against Rh positive antigens. These antibodies enter into the second child through the placenta and cause complications in the second child like hemolytic anemia and jaundice. Thrombocytopenia. It is the decrease in the number of platelets in the blood. This will lead to reduction. Thrombocytopenia. It is the decrease in the number of platelets in the blood. It will lead to the reduction in the ability of the blood to clot. So, this is a bleeding disorder. It is defined as a platelet count less than 1 lakh per cubic millimeter. Another one, myasthenia gravis. It is caused due to breakdown of communication between nerves and muscles. In this condition, antibodies are produced against the person's own acetylcholine receptors at the neuromuscular junction. Acetylcholine is the chemical neurotransmitter. As a result of this, acetylcholine released by the nerve cell cannot bind to the blocked acetylcholine receptor, thereby reducing the transmission of the nerve impulse to the muscle. So, this will cause weakened or no muscle contraction. We have learnt about type 2 hypersensitivity. Now, we will see type 3 hypersensitivity, which is immune complex mediated. So, before going to learn type 3 hypersensitivity, let us know what are immune complexes. Immune complexes are nothing but antigen-antibody complexes. In this case, IgG antibodies form immune complexes with antigens. It is also mediated by complement and participation of neutrophils. Neutrophils are a kind of white blood cells. In our body, antigen-antibody complexes are generally removed by the normal immune mechanisms. But in type 3 hypersensitivity, they are not removed and get deposited in the joints and tissue spaces, which lead to inflammation of the affected parts. That is why it is called immune complex mediated hypersensitivity. Examples of this type 3 hypersensitivity are serum sickness, systemic lupus erythematosus, and acute post-streptococcal glomerulonephritis. Serum sickness is an immune response that results from the injection of heterologous or foreign protein or serum. The proteins are usually from non-human sources like animals, as in case of Arthur's reaction. Arthur's reaction was observed due to administration of anti-influenza vaccine made from horse serum. So here the reaction to horse proteins was observed. It occurs in 5 to 10 days after exposure to the antigen. The symptoms include rash, joint pains, fever, lymphadenopathy, and weakness. Lymphadenopathy is the disease of the lymph nodes. Systemic lupus erythematosus. It is an autoimmune disease in which the immune system attacks its own tissues, causing widespread inflammation and tissue damage in the affected organs. Systemic means it spreads throughout the body. It can affect the joints, skin, brain, lungs, kidneys, and blood vessels. The typical sign of lupus is a butterfly-shaped rash over the cheeks and nose. Acute post-streptococcal glomerulonephritis. Acute is severe in its effect. Post-streptococcal means after the infection with streptococci. Glomerulonephritis is the inflammation of the glomerulus and nephrons of the kidneys. It is a disease of childhood that accounts for approximately 90% of renal disorders in children. It is caused by a bacterium, a group A Streptococcus, which enters the upper respiratory tract of a person and causes sore throat. In some individuals, antibodies to this bacterium bind to the antigen and form complexes. These complexes circulate in the body and get deposited in the glomerulus of kidney, causing inflammation. The fourth type of hypersensitivity is delayed type of hypersensitivity or cell-mediated hypersensitivity. Till now, we have seen the involvement of antibodies which are produced by the B cells converted to plasma cells. That means type 1, 2, 3 are antibody mediated. But this type 4 is mediated by T cells, that is by cell mediated. This is called delayed type of hypersensitivity because it appears after 24 hours and peaks at 48 to 72 hours after second exposure to the antigen. The T helper cells, which are a class of T cells, are involved in this type of hypersensitivity. It was first observed by Robert Koch in guinea pigs while working with tubercle bacillus. Let us see the mechanism of type 4 hypersensitivity. It occurs in two phases. The first is sensitization phase and the next is effector phase. This reaction is caused when CD4 plus TH1 helper cells recognize a foreign antigen in a complex with MHC class II on the surface of antigen presenting cells. These can be macrophages that secrete interleukin 12, which stimulate the proliferation of further CD4 plus TH1 cells. CD4 plus T cells secrete interleukin 2 and interferon gamma, inducing further release of TH1 cytokines, thus mediating the immune response. On the other hand, activated CD8 plus T cells, CD8 plus are another type of T cells, means cytotoxic T cells destroy the target cells on contact, whereas activated macrophages produce hydrolytic enzymes. And on presentation with certain intracellular pathogens, they transform into multinucleated giant cells. The overreaction of the helper T cells and overproduction of cytokines damage the tissues, cause inflammation and cell death. Examples of type 4 hypersensitivity include contact dermatitis, Monto test, etc. Contact dermatitis may be caused by certain jewelry made of nickel or gold, perfumes or chemicals in the cosmetics, and a plant called poison ivy. Here, the irritant or the allergen reacts with the skin protein and induces an immune response. CD4 plus T lymphocytes or helper T cells recognize the antigen on the skin surface, releasing the cytokines that activate the immune system and cause dermatitis, means inflammation of the skin. Monto test. It is a skin test routinely used for the diagnosis of the disease tuberculosis. Here, a purified protein derivative called as tuberculin is obtained and administered on the forearm of the suspected individual intradermally. The site of injection is marked and observed for the reaction after 48 to 72 hours. If an erythema, that is red color, redness, and induration, that is swollen and hardened area appears, it indicates that the person is positive for tuberculosis. Similar other tests are done to diagnose fungal infections like histoplasmosis and dermatophytosis. These are the fungal infections. Chronic transplant rejection is also type 4 hypersensitivity reaction where T cells are involved. Now, let us see how to diagnose the hypersensitivity. So, detection of allergen specific IgE will be done. Accurate diagnosis of allergic disease and the relevant allergens helps to determine appropriate treatment options. Allergen specific IgE can be detected by skin prick testing and by blood specific IgE testing, that is serum allergen specific IgE testing. This is different from total IgE testing. Skin prick testing. This relies on the introduction of very small amount of allergen extract into the epidermis using a standardized method to ensure reproducibility and comparability of results. The results of skin prick testing are read in 10 minutes. Here the positive control taken is histamine dihydrochloride or codeine and 15 minutes for the allergen. And the diameter of the resulting wheal is recorded in 2 dimensions. Wheal is the allergic reaction which is developed by the person. Okay? A positive test is the one in which the wheal diameter is at least 3 millimeters greater than the negative control, that is saline. Skin prick testing can be done for aeroallergens. Example, house dust, mite allergens, pollen and domestic pet allergens. Intradermal allergy testing. In this, a small amount of diluted allergen is injected into the dermis. It has a very high non-specific reaction rate, but it is useful in specific protocols for investigating drug and stinging insect allergy. Blood-specific IgE testing to a wide range of allergens detects and quantifies allergen-specific IgE. It can be used to diagnose all types of allergies, but it is generally less sensitive than skin prick testing. Blood-specific IgE testing is particularly useful when anaphylaxis is being investigated, as the testing carries no associated risk of anaphylaxis and there are very few contraindications. This test can be performed in patients who are taking antihistamines or other drugs that are contraindicated in skin prick testing, and in patients whose risk of an adverse reaction to skin prick testing is high. Now let us see the therapeutic points of interventions of hypersensitivity. The therapeutic points of intervention include allergen avoidance, allergen immunotherapy, anti-cytokine therapies, anti-IgE therapy, and pharmacological therapies. Allergen avoidance. A careful avoidance of the specific allergens responsible for allergic disease should always be the first consideration in managing patients with allergies. This is the primary form of treatment for food allergies and some stinging insect allergies, as avoidance can be a very effective strategy if patients are well educated about precautionary measures. Allergen immunotherapy. Allergen-specific immunotherapy involves administration of increasing doses of allergen to a patient to achieve clinical and immunological tolerance over time up to 3 or more years. So the patient develops tolerance to the allergen. Allergen injection immunotherapy induces T-cell tolerance by several methods, including decreased allergen-induced proliferation, alteration of secreted cytokines, stimulation of apoptosis. Apoptosis is programmed cell death, and the production of T regulatory cells. This results in a reduction of inflammatory cells and mediators in the affected tissues, the production of blocking antibodies, and also the suppression of IgE antibodies. Anti-cytokine therapies have also been investigated to treat asthma. Anti-interleukin 5 therapy has produced some reduction in inflammation. So early trials of human necrosis factor alpha blocking have shown some success, but further work is needed on specific blockers in inflammatory pathways. Anti-IgE therapy. Here, administration of humanized monoclonal anti-IgE antibodies have been found to have some efficacy in treating asthma and food allergies. Anti-IgE treatments may offer therapeutic opportunities for people with multiple sensitivities. So what are humanized antibodies? These are the antibodies from non-human species whose protein sequences have been modified to increase their similarity to the antibody variants produced naturally in humans. Next is pharmacotherapy. The drugs, pharmacotherapy is the use of drugs to treat hypersensitivity reactions. These include antihistamines, epinephrine, steroids, and immunomodulatory drugs. Now, let us see the prevention and treatment of different types of hypersensitivity we have discussed. Type 1 hypersensitivity or anaphylaxis. In this case, desensitization therapy is done, in which small concentrations of the allergen is given initially, increasing the concentration gradually so that the person will not respond to the actual allergen. Epinephrine is a drug of choice for systemic anaphylaxis. Inhalers are used to relieve from asthma. Avoiding the food, chemicals, drugs or clothing responsible for allergy. Type 2 hypersensitivity or antibody-mediated cellular cytotoxicity. Antibody-mediated cellular cytotoxicity like erythroblastosis fetalis can be prevented by administration of IgG antibodies to the mother during pregnancy, which will inhibit production of antibodies against Rh antigen through feedback mechanism. Drug-induced hemolytic anemia can be reduced by removing the drug. Thrombocytopenia can be treated by infusing platelets and administration of corticosteroids. Myasthenia gravis can be treated by symptomatic therapy with an acetylcholinesterase inhibitor like pyridostigmine, chronic immunosuppressive therapies, plasma exchange, and intravenous immune globulin therapy. Type 3 hypersensitivity or immune complex mediated hypersensitivity like serum sickness can be treated by antihistamines or analgesics along with topical medication to relieve itching or skin rash. Topical is applying on the skin. In serious cases, corticosteroids such as prednisone are prescribed. For systemic lupus erythematosus, anti-inflammatory drugs are used to reduce joint pains. In case of acute post-streptococcal glomerulonephritis, the treatment is focused on relieving the symptoms. Here, antibiotics like penicillin will also be used to destroy any streptococcal bacteria that remain in the body. Blood pressure medication and diuretic drugs may be needed to control swelling and high blood pressure. The type 4 hypersensitivity or delayed type of hypersensitivity can usually be resolved with topical corticosteroids and trigger avoidance, that means avoidance of allergen. Use of brown soap is advised for the treatment of contact dermatitis. Another one, autoimmunity, has been considered as type 5 hypersensitivity. Auto means self. Okay. This was predicted by Paul Ehrlich as horror autotoxicus, means fear of self-poisoning. This is mediated by IgG or IgM antibodies. Examples of autoimmunity are Hashimoto's thyroiditis, Graves' disease, myasthenia gravis, etc. Before going to end this topic, I would like to recall what we have learned till now. We have learned what is hypersensitivity and the mechanisms involved in different types of hypersensitivity. Hypersensitivity is an allergic reaction because of overreaction of immune system of a person. The types of hypersensitivity are type 1, type 2, type 3 and type 4. Type 1 hypersensitivity is immediate type called as anaphylaxis and is mediated by IgE antibody. Type 2 hypersensitivity is cytotoxic and mediated by IgG and IgM antibodies and also complement. Type 3 hypersensitivity is immune complex mediated and the antibody involved is IgG. Type 4 hypersensitivity is the delayed type which occurs within 24 to 72 hours and is mediated by T helper cells. Autoimmunity is considered as type 5 hypersensitivity in which antibodies and T cells react against a person's own antigens. After knowing the mechanisms, we have seen how to diagnose the hypersensitivity. The diagnosis include detection of allergen-specific IgE, skin prick testing, intradermal allergy testing and blood-specific IgE testing. We also have known about the therapeutic points of intervention which include allergen avoidance, allergen immunotherapy, anti-cytokine therapies, anti-IgE therapy and pharmacotherapy. After that, we have seen the treatment of different types of hypersensitivity like treatment of anaphylaxis with antihistamines, treatment of cytotoxic reactions with corticosteroids or administration of IgG antibodies as in the case of erythroblastosis fetalis, treatment of immune complex mediated reactions by anti-inflammatory drugs and treatment of delayed hypersensitivity by the use of brown soap, etc. So, thank you for watching this. Thank you.